So welcome everyone. Welcome today to the Indies of Color chat. Today we are discussing coronavirus, the immune system, naturopathic considerations, and just whatever else comes to mind. I know we'll talk about some disparities in coronavirus and how it's affecting the communities. And all kinds of other things. So thank you all for watching. Thank you for tuning in. Be sure to share this conversation. Be sure to share this video so that we can all, have the conversation. I would like my guest panelists to introduce themselves. Let's start with Intern Princess. Tell us who you are, where you are, and, just what you're interested in.
Okay, so I am Intern Princess Burnett. I currently am an ND intern at National University of Health Sciences, as well as I am a dual student in acupuncture here. And so I am currently located in Illinois. And so some of my focus for when I get out in practice would be women's health. What is one of my biggest things, I would love to work with women to help with different reproductive issues, as well as mental and emotional health, and more so wellness care and things of that sort. Tying in the acupuncture as well to help give them different tools to utilize and help with treatment.
Excellent. Welcome. Intern Kamilah.
Good evening, everyone. My name is Kamilah. I am also a student at National in Lombard, graduating in December. I just started the acupuncture program this trimester, so I will be adding that to my toolbox as well. I have an interest in pretty much trying to educate people on how to have an overall healthier life, specifically GI issues and diabetes, high blood pressure are some of my interests.
All right, welcome. Intern Braxton.
Hello, everyone. I am Intern Aquila Braxton.
Speak up a little bit more.
I am Intern Aquila Braxton. I'm attending National University of Health Sciences, and I am also graduating in December. My focus, when I get out and practice, will be more so focusing on how mental health is associated with a lot of the chronic diseases in the Black community, and I want to help us overcome that.
Excellent. Welcome. And Dr. Muhammad.
Hey, so I'm Dr. Muhammad. I am a naturopathic doctor in practice in Missouri. I went to SCNM in Arizona and did residency there. And then I moved out here to Missouri. My focus is gastroenterology, metabolic syndrome. Then I also did training in hypnotherapy and kind of a lot of mind-body modalities. So I use that as well. And the bulk of my practice is pretty much GI and metabolic syndrome.
Excellent. And I am Dr. Turshá Hamilton. I am currently located in New Orleans, Louisiana, and I am focused on diabetes, hypertension, with a real strong focus in education. I feel like there's a big gap chasm between what people know and are told to do and what actually happens. And so my goal is to educate and to help people to reach their goals through knowledge and then implementing that knowledge. And so thank you, ladies. Thank you, doctors, for joining us. Let's get started. Coronavirus. Thoughts. What is the biggest thing that you guys learned about coronavirus since this whole pandemic started?
I would say that it's real. A lot of people deny the existence of the coronavirus, and I find that there's just a disparity in understanding and education around how viruses work. And so, I see a lot of metabolic cases, and these are people that actually know people or are people that have had coronavirus. I have patients who have husbands or family members who died from COVID, and I have no other people who just totally deny that it even exists, So, yeah, that's the biggest shocker for me.
Sorry. Can y'all hear me?
Yeah, when you're closer.
Okay, let me get all up in y'all. No, but I would have to agree that it is real. A lot of people have played it like it's a conspiracy theory, like it's a hoax, like it's something to influence the elections. And while some things may be in play right now, the reality is a lot of people are dying from it, whether it is, you know, directly from it or some complications from it. People are dying and people have lost family members, and the insensitivity that so many people have, it's just ridiculous. And you know, we're being exposed to the heart of people just by this one disease, just by this one infection. And it's really sad how we can go from one extreme to the next really rapidly just because someone says, hey, wear a mask. And that is very offensive to people at this point. And it's like, well, there are people who need, you know, certain precautions to be taken, and we don't need to minimize their experience just because you're not directly affected or you believe you're not.
Right.
I think for me, one of the biggest things is seeing the different aspects in which the virus has affected. Because, you know, we were told initially, oh, it's only affecting the older population or those who are immune compromised. But now we're seeing the spread of the virus affecting those as early as infants, all the way up until the age of the elderly community. So it's more so raising awareness about how are we able to really set up protocols to really manage and treat these individuals that are being affected.
And for me, the biggest turning point or shock for me during all of this, I forgot to say that I am an x-ray tech every weekend. And I've been taking x-rays basically for 9 years, getting paid to do it for 7 years. And the facility that I work at is rehab. And we started getting the post-COVID patients, the patients coming in that now had to relearn how to breathe, that have to go through different therapies of how do I shop again? Just little daily activities that we take for granted. So that was an eye-opener for me, because it's something that we totally didn't think about. We thought, oh, people recover, they bounce back. We never thought about the people who don't technically bounce back. Or there was a patient in my facility, he had a stroke while he was in the hospital of him recovering from COVID. So dealing with the stroke aspect and helping him in that way. And just trying to change the mindset as far as dealing with the asymptomatic people that are out there. I feel like it's kind of human nature where it's like, well, I don't see it, so I'm okay. And we have to remember, just like with the HIV pandemic, you didn't see somebody was sick necessarily, but now we are hopefully more aware that we take precautions and do certain things to keep that virus, you know, at lower rates. And we have to remember, we have to do the same thing with COVID.
Thank you guys. And I'm gonna just call y'all doctors. So Dr. Hamilton or Dr. Kamilah, I'll probably call you Dr. Kamilah because I might confuse myself. We want to come back to that definitely. But I think for me, one of the things that was, that is most shocking is how things are morphing so quickly. And I don't know if it's just because things are being reported more in some areas than others. Like, you know, in the beginning, beginning of the year, when they weren't testing anybody, they assumed it was the flu. Then they started realizing it's not the flu, it's something else. And then they're like, oh, maybe people who lost their taste and their smell, it's a thing for coronavirus, right? Well, how many other people had lost that before and it wasn't reported or it wasn't told to us? And now we have all of these children who have these like coagulopathies, is that what it is? Like the inflammatory conditions. So, you know, just the rapid way that it's changing, or that it seems to be changing, or at least that it's being reported, for me is one of the biggest shockers. And to speak to what Dr. Muhammad said earlier, you know, the fact that it's a novel virus, it's a new virus, we know how viruses work, but we have to remember that this is still new to us. So we have to look at it as an individual virus within the scope of what we know of viruses. So we talked about asymptomatic patients. I know that one of the biggest problems, as a couple of you mentioned, is that a lot of people will be carriers and they won't show any symptoms. You guys were telling me that you just recently read an article about that. Share with us what you read.
So we looked at read a study just recently where it was looking at a small Italian village in Italy. And what they found was 40% of the people were asymptomatic. They were positive for COVID, but they were asymptomatic, and they remained asymptomatic the entire time. And this study believes that they were able to keep their COVID numbers lower because they did more testing. They also did the immediate quarantining. And that just speaks volumes for it to show 40% never showed any symptoms. So just imagine if they did not take the proper precautions and these 40% were out living their life, they're living their best life, and coming into contact with other people, traveling outside of the town, maybe even traveling across the world. So just imagine what could have happened from those 40%.
For me, from what I gather from that is just simply that not all viruses will show itself. It will not present itself initially. HPV, human papillomavirus, is a lot like that. HIV can be like that for years before you notice anything. Gonorrhea, chlamydia, I mean, you name it. A lot of these viruses and bacterias or infections that people get, depending on the way your immune system is set up, you may be a carrier, you may express it, you may not. And to think and assume that because you have no symptoms means immunity is kind of, it's not the proper way to think about it, basically. There are better ways to think about it, like, okay, maybe I don't have any symptoms, but am I a carrier and can I affect other people?
Okay. Intern Burnett, did you have anything to add?
In reference to the article as well, it makes me think about people who are asymptomatic and they don't display the symptoms, but it's like, what are those individuals doing to having alleviated some of the symptoms by either taking care of their immune system? What lifestyle factors are they implementing in their day-to-day activities? Like, some of these things are essential to also take in consideration to when assessing patients that are asymptomatic, because it's like, how's that person living their lifestyle to kind of counteract those symptoms from developing?
Dr. Muhammad, in your research of coronavirus and the immune system, what are some of the things that were most profound for you that you've noticed that came up in the research?
So it is raining here. Can you guys, is that like a problem, or are you okay with? Okay.
No.
So when you look at the research relative to like coronavirus, SARS, like lung issues, you find that there is just a significantly reduced NK cell capacity or activity, the natural killer cells. There's reduced T cell activity, right? These are both immune components that actually do fight off bacteria. You have like also reduced activity of your phagocytes. And so there was a study I just read, I don't know when I read it, but I just read it, and it was probably last night, about glutathione. And so we know that endogenous glutathione is reduced in patients who have some of the worst outcomes relative to COVID. So like people who are dying have some of the lowest like endogenous glutathione levels, right? So glutathione is our body's main antioxidant. We know that, just being overweight or being in a category of overweight reduces your immune function, specifically reducing your natural killer cell activity. So if these are components that we know are are absolutely required to fight off viral particles, whatever. And we know that if populations have higher amounts of metabolic syndrome, already can assume that there's going to be reduced immune capability. So a lot of it had to do with more antioxidant status, and then also chronic inflammation, which is, metabolic syndrome, which is America. So.
Pretty much. So let's talk about inflammation. What is it? How do you describe it to patients?
When I see patients I say chronic inflammation is America. That's the definition. So basically, I will tell people, if a patient comes in and they are like metabolic syndrome, they automatically have chronic inflammation. We can measure that in many different ways, right, in the body. There are blood markers we can use. There are specific like urinary metabolites we can use to assess inflammation in the system. And so pretty much anybody that I see, I say we all kind of deal with some chronic level of inflammation. So I just try to put patients in prophylactic.
You did hear that. And it's okay.
I'm gonna close the window. So that's how I describe chronic inflammation, just kind of like living in America, being environmental toxins, like things in our diet, things we're exposed to. So I think everybody has some varying level of chronic inflammation. And, you do need some level of oxidation in the system to have a healthy system. But it is in America an overwhelming issue of too much inflammation.
I recently was talking to somebody, like a former college classmate of mine online. He'd asked me something and I'd responded something about body-wide inflammation. And he was like, oh, I didn't even realize that was a thing. Like he had never thought about inflammation not being localized to a joint or a part of the body, that it was, it could be systemic. Do one of you have a way that you can describe it body-wide?
I can just describe it as it is your body's response to tissue damage or to some type of invasion in your body. For example, if you have an allergic reaction, your body will respond to that. If you have some type of virus, for example, your body will respond to that. So it's your body's protective mechanism to preserve your tissues, but in the same time, it can cause tissue damage.
Dr. Muhammad, it's interesting that you mentioned glutathione and antioxidant status, because it's something that we tend to think about pretty much, but that's not a common thought, amongst the rest of the country, the rest of the world, is antioxidants. And, we're always saying, eat your green leafy vegetables, eat your fruit, eat your vegetables, because antioxidants, woo, woo, woo. But when you said that, it kind of dawned on me that that's, another reason, it's another layer to this thing that we say all the time. Your body needs antioxidants because of that. And the fact that all of these pre-existing conditions run through antioxidants. They, it's very oxidative. And so this is, I guess, one of the main reasons why people are more affected by the disease.
Yeah. I mean, geez, I thought I closed the window, but obviously that was not enough. Wait, what was your statement?
Antioxidants and yeah.
So yes, obviously it's like multifactorial, but when you look at it from like a basic like 1 + 1 = 2 level, yeah, it comes down to like an imbalance in the system, like too much oxidation relative to antioxidant status. And when you look at like I said, those cases that portend worse outcomes in COVID, those are the metabolic cases, or the cases of people who have chronic lung disease already. And already in those pictures, you find studies, like study after study, detailing higher amounts of TNF alpha, higher amounts of certain interleukins that promote down the line like inflammatory cytokine processes. I mean, even just in the gut, of these patients, you have a whole like dysbiotic flora, and then this dysbiotic flora, certain gram-negative bacteria, the walls release LPS, right? LPS triggers inflammation in the system. So yeah, it's just like a soup of inflammation, inflammation soups.
Inflammation soup.
I don't want to comment on that, because I think that a lot of people aren't aware of like the range of inflammation and the range of what metabolic syndrome can look like. While you may not have hypertension or things like that, if you fall asleep rapidly after eating a high carbohydrate meal, you likely have some components or features of metabolic syndrome. If walking up the stairs and your knees start hurting, that's another sign of inflammation. If your back is hurting, if you have headaches often, if you have an intolerance to heat or cold, those are just examples of your body's inability to adapt to the environment. And it could be a result of, increased exposure to toxins or something is in your diet that's contributing to it. But don't assume that just because you don't have hypertension or high blood pressure, or just because you don't have lung disease, just because you don't have kidney disease, that you're not a candidate to be negatively affected by the results of inflammation, for that matter.
Also, if I can add something there, I think too, for me, it's more so like a cascade of symptoms. So for example, you have a person whose diet is already poor, and they already are not getting the essential nutrients as well as antioxidants and all of the other vital vitamins that are key to the body's functioning. And so what you have is this cascade that builds up over time of increased toxic load, chronic inflammation. And, so it's more so a development that continues to stagger. And so the more you don't take care of yourself, the more you don't eat properly, the more you don't exercise, the more you don't regulate your stress, those things contribute to the long-term development of things that are essential chronic disease in the body. So
yes, I agree with what everybody said. One thing that I've said for years is life is about balance. So I look at it as when you're dealing with, inflammation, yes, inflammation can actually be good. It can be the body's way of protecting itself from different infections. However, the issue comes in is when it is chronic. So when you have that teeter-tottering balance and you tip it too far over, that's when you have a problem. Same thing with what Dr. Burnett was discussing with the layers of things, the lifestyle, what you eat, are you exercising, and stress, that as well. So when you add up all these different layers and then you really tip the scale, then you're not giving yourself a chance to really, a fighting chance to fight off infections, things of that nature.
So let's talk about some of the healthcare disparities. So we know that it's a disease or it's a virus that is affecting the entire world. It's affecting great amounts of people in the US, but is disproportionately affecting Black and Brown communities. What are your thoughts on that? Like the causes, the response to it, whatever it is, what are your thoughts on that?
So I'll say, once again, it's another multifactorial thing, right? So we know there's a huge disparity in regards to outcomes from COVID, right? Death outcomes specifically. And when you look at population studies or observational studies, you find that like Black patients, like Black people, we tend to work a lot of service roles and not a lot of like managerial roles. So we don't really occupy the roles that will allow us to work from home. So a lot of us have to be out working service roles, being exposed, and we don't have the ability to just stay at home. So that's one. Like another thing is like a lot of Black folks don't really have the best quality health insurance, right? So what that means is like we sometimes will use like the ER as our primary care doctor, right? So it's like we wait until, something is serious until we go to the hospital. I had a guy come and see me, and he has diabetes, and he had something going on with his toe. He had a cut that was just not healing, and he did not want to go to the doctor. He didn't think it was serious enough to go to the doctor, right? He can't feel anything. And so, you know, I think serious is relative to, okay, if the toe falls off, then I'll go, or if it's like bleeding, or then I'll go. But until then, like, I'm not going. So that happens a lot in the Black community. And it has a lot to do with like, just like socialization, racism, and a lot that like that goes on in our community. So that's like two things. And another thing is just like the level of like healthcare in our communities, and the quality of physicians that we do see, and then also our health specifically and relative to diet and lifestyle. So it is multifactorial.
I agree, but I also wanted to consider, because a lot of people, they did say this is more of like, oh, it's a lifestyle thing. You know, there are people who have hypertension and diabetes, and they're the people more at risk for it. But to be honest, a lot of people don't understand statistics, nor do they understand the language of statistics. So Black people may have the highest rates in certain conditions, but that doesn't mean that we outnumber other people. Highest rates is associated with population size. And so we have a smaller population size, but we're in America, and we eat like Americans. And for that reason, we're going to have American-like diseases. But we have other counterparts, like white people, for example, who outnumber us in all of the conditions, really, that are very much preventable. But what we have, I think, is that on some aspects, we are dealing with some form of racism. And that I just want to be clear about that, because I don't want Black people to think, oh, I have hypertension, therefore I am more at risk for developing the harsh effects of COVID. It's not really the case. It could be just that the color of your skin is influencing the treatment, the quality of your care. So that's really what you do have to consider as well.
And then also too, the historical aspect of how Black people have been treated in this country, specifically in the healthcare. You know, we have Miss Lax, her cells, you know, the Tuskegee experiment, as well as countless, I would say, nameless Black women that were used as experiments in order to, you know, have great advances in gynecology. You know, so as a whole, as a community, we tend to distrust the healthcare community because they have been experimenting on us. We also, I remember growing up hearing rumors, you better not sit up there and put your organ donor on your driver's license because they're killing Black people and taking their organs. We also know when we go to the hospital that Black people are treated differently. We also know statistically that you have brand new graduates, brand new physicians out here that still believe that Black people feel no pain, or we don't get the proper medications because they automatically assume like, oh, you're gonna sell the drugs or you are on drugs. Being in a hospital setting, I've seen specifically Black women who, thank God I'll be alone in a room with them, and they'll be like, you can do it, you can do it, like talking themselves through pain. And I've had to literally tell them, you know what, sister, stop. I understand what you're trying to do. If you need to cry, go ahead and cry. Take your time. It's just you and I'm not rushing you. So we also had that mentality of like not going to the doctor because it's like, I'm okay. I'll wait until, you know, I'll just shake it off. I'll wait all the way until I'm about to die before I go see somebody, you know. So just the mindset, and it's a lot of education within our community that needs to take place of the importance of taking care of ourselves.
And I agree, like with everything everyone has spoke, I completely agree. And I think that it comes with also educating our community, especially our Black community, and educating them to knowing other means. You know, some people think that, well, I gotta go to the hospital and take these drugs, or I gotta do it this way. There's other means, but you have to be proactive early enough to help alleviate some of the chronic disease, taking a more proactive stance in your health, knowing that your health is valuable, it's important to make sure you are living your best, being your best self, and living, you know, and taking care of your family, and educating them on the ways in which to also value the importance of health. And another thing is learning about natural medicine and learning about its benefits, that it can contribute to your life, and giving you the different mindset to understand that natural medicine and natural means of health is also great, has wonderful benefits for the health. And you don't always have to rely on the pharmaceutical and the drugs and things of that sort.
So the question was just asked, is it true that corona vaccines are being tested on Black people first? She said she saw a friend post that recently.
So I'll say it's not necessarily true or false, right? So there are studies going on in Britain, there are studies in Africa, there are studies in Brazil going on right now. I'm not necessarily sure what the relative doses are. So that's the issue with studies. Like, there are so many different factors that go into studies and safety of studies. So I know that there's like this clip circulating with like the Gates, like Bill Gates and his wife talking about who should like get the vaccine first. And his wife's like, oh, well, Black people and Natives should get it first, you know, in this country. And a lot of Black people are like really, first of all, offended, because like these people are not even medical professionals, right? And how do they have the like the position to say who should be afflicted with this or who should receive this? And like Dr. Kamilah was saying, there's such a long history in this country, since we've been in this country, of like medical apartheid, like the Harriet Washington book, Medical Apartheid, of Black people being experimented. And there's one specific incident that happened circa like the late 20th century, like 1989 actually, in Los Angeles. The EZ vaccine is like a measles vaccine, where these Latino and Black moms were not made aware that their children were receiving an experimental dose of the vaccine. So the vaccine study, like, they came out and apologized for it, but you know, these children had received up to 500 times the normal dose, you know. And so it's just kind of like, that's what I'm saying, like relative to the studies, it's like, okay, in these different populations in Africa, in Brazil, in Britain, is everybody getting the same dose, right? So what does that look like? So I'm not sure if we're the first people being tested in America, but there is a clip going around saying we should get it first.
Yeah, I actually did hear that that so like a bunch of studies, vaccine trials, I should say, were being done in continental Africa because Africans needed to be tested and protected first, which, you know, on one hand, you think, well, yes, these are kind of the populations, or those are some of the populations that need to be supported. But then you also think, what, as you mentioned, what exactly is in the vaccine? What's the dosage? What's the, you know, are you being ethical when you're doing it? Because you don't have a history of being ethical when it comes to certain populations. So what does that look like? So to your question, possibly, yes. And who knows? Because, you know, I also heard somebody once, or several people say, it's better to ask for forgiveness than to ask for permission. And so if you can just go ahead and do the vaccine trials and then come back and say, oh, I'm so sorry, I gave your child 500 times the dose of everyone else. Oops, I shouldn't have done that. Then you've already gotten your data and you've already done the damage. So there's that. Let's talk about, several of you have talked about like the basic things that we can do to help basically fortify our health. Because there are so many different factors that affects our health in this country. It is, you know, internal, it's mindset, it's spiritual, it's communal, it's environmental. When you're talking to patients, especially Black and Brown patients, especially those who are disproportionately affected by disease, regardless of what it is, what are some of the things that you try to get your patients to think about and or start doing in order to help fortify their health?
Oh, were you gonna answer, Dr. Aquila?
It's cool. I'll wait.
I typically start with diet, with food. That's the simplest thing, and everybody has to eat. So that's where I'll start. And I typically just recommend like pushing plants for people, because a lot of people don't eat enough fruits and vegetables. Like I can literally count on one hand how many patients I've seen that actually eat enough. And I've seen thousands and thousands of patients. I can count on one hand how many actually eat enough fruits and vegetables in a day. I count on one finger actually. So it's just like, it doesn't really exist. So I just really try to start there. That's where I start. There's a lot of other things, but I'll just say that's where I start.
For me, I always first consider some of the things that you react to. So if you're passing too much gas, if you're belching a lot from certain things, maybe we should cut that out for a minute, because maybe you're reacting to it just based off you being sensitive to it, even if it's something that you've been eating for your whole life. Try to take some of those things out of your diet. I know dairy is a major one for for a lot of people. Not going to say all Black people, but some people who are of color do tend to have a sensitivity to dairy, and dairy is definitely pro-inflammatory, which means it can cause inflammation. So if during this time you're trying to think about, hey, let me lower some of my risks, how about we just avoid dairy for the moment until we have a better understanding of it, and trade it out with certain things like almond milk, cashew milk, coconut milk. There's a lot of, right now, because of the, I guess, rise in like vegan diets and raw diets, you have a lot of options where you can start switching out some of your favorite foods for something a little more healthier and less inflammatory. So that's what I like to do. And I always tell them this is temporary, doesn't have to be lifelong, because a lot of people, when they hear, oh, I gotta cut this out for the whole, my whole life. But when you clean up your diet, you oftentimes see a regression in your symptoms in terms of response to certain foods. Because maybe it wasn't the dairy, maybe it was some other food that you were eating that contributed to that. But as we clean up our diet and remove the things that we have a reaction to, then we can have moments where our body can build up the tissues so that it won't be so permeable, which means so that things won't get through as much and cause so much of a reaction. And that's pretty much where I start.
I think for me,
Give me 1 second. I just wanted to comment on what Dr. Braxton said. That is, for those of you that are watching, that is how body-wide or systemic inflammation can really set in. There are multiple ways that it can, start, or multiple reasons for it to be in existence in your body. But eating something that your body does not like is a surefire way of getting body-wide inflammation. So if you find that you have, these strong reactions in your body, you have these aches and pains and you don't know where they're coming from, you're having sinus infections or, headaches often, you would probably do good looking at your food and consider, for a short amount of time, a few weeks, removing some of those things that tend to cause more inflammation or more reactions, and see how your body responds, because that, again, can be a source of body-wide inflammation, which can in turn decrease your antioxidant status, which can in turn put you at greater risk for things like coronavirus and other things. So just kind of wanted to put that in context. Intern Burnett, Dr. Burnett.
I was going to say that for me, when the person establishing the relationship with the patient, that's important, and educating them as to what naturopathic medicine is so that they can fully understand the benefits and how it can help them. So in breaking down the different components, such as the determinants of health, and what does that encompass, and taking them through what each factor is. For example, as Dr. Muhammad and Dr. Braxton mentioned, the diet, taking them through the steps, helping them and to explain to them what a good diet looks like, what that means, taking them through exercise, how much exercise should you be getting, and what are some of the things that you can do to increase. So taking them through the steps so that they can understand, giving them the proper knowledge to understand that, so that they can begin to see, okay, this is what health looks like. How can I start to implement that for me? And what is my best self what does that look like for me and what do I want that to be like for myself? So I think that's important.
So what do you think is a good amount of exercise, since you mentioned exercise? For someone who doesn't exercise, who's pretty sedentary, who doesn't have a lot of people around them exercising, what do you recommend for that person?
So I would start with asking that person, what does exercise look like for them? Being that they don't have a exercise routine, what do they feel most comfortable with doing? How can we begin to get you out of that mindset of being sedentary and begin to be more active? Is there a amount that you would be willing to do? What can you do? Tell me what you can do before because I want you to have that understanding for yourself. You know, my job is to educate you, but also to listen so I can understand what it is that we can tag team and we can really work together to develop what's best for that person.
Thank you. Intern, Dr. Kamilah.
So pretty much just like Dr. Burnett had hinted towards, we're looking at the whole person, so it's layers. So I'm also looking at mental, emotional, the environment that you're in. So when we're dealing with our community, a lot of us do want to, I know definitely Dr. Braxton and I, we want to work with lower income families, people. So you're dealing with people that are not in a safe environment. Mm-hmm. And when you're not in a safe environment, you're constantly on a fight or flight. And in order to digest and process your food, you need to be in rest and digest. But if you're constantly on this, like, who's coming after me? What do I have to look out for? Whether it's the police officers, your neighbors, your job, whatever stresses are coming your way where you're feeling like I'm constantly on a fight and flight, how can you digest your food? So I'm looking at that aspect. As far as diet, which we've all said is major, the best thing is to get your proper nutrients from your food as opposed to your supplements. And if you're not digesting your food, it's just sitting there or just going straight through you. And a lot of times people in lower income, they're eating the processed foods. So not only is the processed food sitting there, you're not getting your proper nutrients at all. And I try to explain to people, this is not a race, it's a marathon, so take your time. You do want your plate to look like a rainbow. Take your time. If it's a thing where it's like, let me add in one vegetable for each meal for 1 week, and then next week do 2 vegetables, and then mix it up. Try to do something different. Don't try to do a thing where you're just going at it all at once. Me personally, I want to see lifestyle change. That's what I want to see. I don't want you to, oh, I'm gonna go on this diet. No, I want you to make a lifestyle change. And you have to understand that I'm 41 years old. So technically I've been eating this way before I was born, because whatever my mother ate, that's what she fed me. And then when I came out the womb, whatever my parents were eating, that's what I grew up eating. So you have to understand that if you're 29 years old, you technically been eating this way since way before you were born. That's a hard habit to break. So give yourself some grace, and just take it one step at a time.
So I laugh because the comment says, as I'm sitting here eating a buffalo mac and cheese frozen dinner. Thank you for that, cousin. All right, so the question was, the next question was, not a big fruit and vegetable eater, but recently started juicing every day. Is this a good, is this as good as eating them?
So, sorry.
Go ahead.
Me personally, I would say eat it, because that way you're getting fibers, you're getting all of the proper nutrients and minerals. You should really be eating it. You obviously, right now we have COVID, so we don't have farmers markets, but when farmers markets do come back, that's a great way to get your fruits and vegetables. I've been to the Amish community, and there is a huge difference with their fruits and vegetables. Not only the colors, the smells, the taste, And if you happen to get some fresh fruits and vegetables, you may actually change your mind. I would say for right now, okay, but work yourself up to eating the actual fruit and vegetable.
So just to comment on that, like the freshness. Recently, my dad in the last couple of years started, gardening, and I told him, Dad, look, it's gonna taste different, it's gonna smell different, it's gonna be a little different. The nutrient value is gonna be different because you're gonna put all your energy and heart and soul into the soil, blah blah blah. And at first he was like, yeah, whatever. And then it took him like a year. He was like, this is great. This tastes good. So it really is a thing, like between having it fresh because or eating it local because the soil is generally richer, but then also having it fresher off the vine, so it's ripened on the vine, which means that it gets more nutrients, it gets more flavor, so you get it that way. Other comments?
I will say this, something that I find a way to kind of sneak fruits and vegetables in is like smoothies. So that's something that I promote heavily in my practice. Because like I said, I just find that people don't eat enough fruits and vegetables, and I typically try to have them smash as much as they can in a day, just because there's so many studies showing the level of inflammation people have with metabolic disease that I'll try to like have them sneak stuff into a smoothie. And kind of go about getting more servings in that way. And then one thing I will do is tell people to like make their vegetables in bulk. So the cruciferous family, I like always promote those. So I'll say like make a big batch on the Sunday of cabbage or broccoli or whatever, and just scoop some out every night so you're not having to make it every day. But it is absolutely imperative that we all increase our fruit and vegetable intake. Like we just have to, and I typically recommend 5 to 9 servings a day, with one serving just being half of a cup. So.
Okay. Other comments?
I was just gonna say that, well, it's a good thing that the person who did comment, I didn't see the comment, but it's a good thing that the person is juicing at least. That is a good start. We don't want to take away from the value in that. So every little start that you can do is awesome, and also just evolve as you continue to juice. You like Kamilah said, like Dr. Muhammad, just make sure that you are finding different ways to incorporate fresh foods into your diet. It's always better to do things the way they naturally occur than it is to have them processed. But nonetheless, good job for at least starting.
Yes, I agree. Definitely, it also, it starts from developing the patient's comfort and meeting the patient where they are. So if the patient is able to do that, okay, let's continue to do that. And how can we work up to increasing more into the diet and getting the patient to understand? And I'm a big believer in setting patient goals. So setting a goal for a patient, setting a weekly goal to help the patient develop the more tolerance and develop the thrill for want to get healthy and wanted to improve always. So I think that's a good thing.
Thank you. One of the things that I've heard is juice your vegetables, eat your fruit. So if you're juicing, try not to juice more fruit than vegetables, because the benefit of the fruit, a large part of the benefit is including the fiber. When you remove the fiber from fruit, you end up getting more sugar into your bloodstream faster. I'm not going to say that it's the same as eating candy, because I've heard people say stuff like that, but because you still have all the nutrients and stuff, but you are getting sugars in quicker than if your body actually has to work to process that sugar outside of the fiber. So definitely continue to juice. Great job there. Try to juice more vegetables than fruit, and then add some like blended foods in there as well, as Dr. Braxton mentioned. So the next, one of the other questions was, or statements is, I can't get my 2-year-old to eat fruit and vegetables. Any quick tips on that one for you guys?
Let them help you.
Well,
I don't have children yet, but from what I've heard is let them help you prepare the food and get them involved. Let them help you even when you're in the grocery store shopping for the different fruits and vegetables. Try to make it fun for them. Um, I've heard of other things, doing kind of similar things where doing smoothies to try to get that and to trick them into taking it in their system. So it's little tricks like that that you can try.
And also, like, make sure you introduce one at a time. So maybe this week you could do bananas, or maybe do bananas for like 3 weeks if you can, or then then introduce kiwis and then introduce strawberries. But don't try to introduce so many at once; it's overwhelming for them. So just try to introduce one thing at a time. Don't give up right away, like Kamilah said. If you make it fun for them, try to make a happy face or something like that with their food, and just challenge them. Let's play a game. Let's see who can eat it faster. Well, not necessarily faster, but something that is enticing to your child. What entices them. So just try to do it in that manner, but also make sure that you're doing it one fruit at a time.
One of the things that I saw, and this was a friend of mine who has little children. They're vegetarian. The children, they all they know is vegetables. And then one day, one of the children was like, "I don't like this. You ate it for breakfast. How do you not like it already?" So do know that children act funny, and they will be finicky. So just because they say they don't like something once, don't give up on it. Maybe switch it up and try something else, but bring that back around, because even children who only know vegetables will claim that they don't like vegetables at some time, and that's that. I also had a Vitamix demonstrator in Whole Foods. He was making smoothies, and one of the things he said that I was very impressed with is he said you can put like cauliflower in like your fruit smoothies, and the kids wouldn't even know that the cauliflower was in it. So, creating foods like that and adding the vegetables in it where they don't necessarily know it can be helpful. Another friend of mine here, their family actually grows and sells produce, and they had like an abundance of squash once. And so mom was putting squash in everything. She eventually blended up and started putting it in like the spaghetti sauces and like gravies and other things like that. To one, because she needed to use up the squash, and two, because her children, who are all teens, but they were just tired of seeing squash. And so to kind of add that to their meal. So, you can get creative with it. And incorporate it that way. Anybody else have anything on that? Okay. All right, so let's shift back to coronavirus. A couple questions asked about masks. Do you know about the different types of masks, and what's the best response to those screwheads out there who say that wearing a mask is taking away their freedom and bullshit like that? America, because, America. So what are your thoughts on masks?
I will go. So there are two types of masks that the CDC has recommended. One is the surgical mask, and I don't have an example, but they're typically like, you kind of like fold them out and then there it goes. So that's a surgical mask. And then there's an N95 mask. That one is really, they are recommending that is for the healthcare providers and workers and things like that. And in all honesty, the N95 is the best. However, it does have a decreased ability. It lowers your ability to breathe properly. So what they're recommending is that patients who have pulmonary diseases or lung diseases, heart diseases, things like that, you shouldn't wear those types of masks. But at any given rate, if we can compare things, because I like to compare, think about STDs and think about coronavirus. Okay, So one sure way to protect yourself against STDs is abstinence. That's one way. Another way is wearing a condom, or the male wearing a condom. And to be honest, condoms don't protect you 100%. They all have some level of protection from an STD transmission. Same thing goes with the mask. While you're not going to be 100% protected, you still would have a barrier between you and that virus. And those two masks in particular can protect you from aerosols and droplets. But the N95 mask can protect you from smaller aerosols like the coronavirus. So I would say, there's no point in getting into an argument about it. There are people who have their opinions. They're very strong about it. You protect yourself. You're not going to get into an argument. Hey, you wear a condom. If you're not going to get into an argument about that, don't even waste your breath on that. But do know that there is some protection. I know that there are people who are going to find some studies that will say, oh, it's terrible for you, but it's really not, because, you don't find putting a water filter on your faucet as a terrible idea just because it doesn't 100% protect you. So just, consider that it is decreasing your exposure to it and decreasing your ability to pass it on to someone else.
Thank you. Anyone else have any other comments?
Just be mindful that if you are wearing the N95 mask, like Dr. Braxton said, it's hard to wear this for a long period of time and breathe. As a healthcare worker, when we wear it, even if we wear it after an hour, you tend to get marks all on your face. Also, too, if you do have one of these, make sure that you properly have it on. I'm not going to put this on my face because I have my makeup right now, and this is my work one. But you want to make sure that it's completely sealed around your nose and mouth. Also, too, the lower strap, in order to adjust it, you can bring it up higher behind your head to tighten it up. And that way you have a better fit. I feel like when I go out, I tend to see this a lot. Not helping, ways that viruses and bacteria get into your system, not only through your skin and mucous membranes. You can look at them, they're like the bouncers at a club, they're gonna be your first defense. But when you have openings in your body, like your mouth, your nostril, your eyes, those are where droplets can enter. So when I'm at work and if I'm dealing with a COVID patient, whether it's possible COVID, active COVID, or post-COVID, I actually have on goggles. I have on my N95. Sometimes we probably shouldn't be doing this, but sometimes I'll even have this under my N95 for extra protection, as well as other gear that we put on to cover those areas. So being out in the public, just do the best possible thing that you can do to not only protect yourself, protect your family. Yeah. And it's like, at the end of the day, like I heard I think it was the governor of New York, it's not about you. It's also about other people as well. So let's not be selfish.
Yeah. So the only thing that I have to add about the masks is don't wear crochet masks, because they're cute, but they do nothing. Like literally, it's like putting your fingers in front of your face because it's big holes in it, literally. Unless you have like a surgical mask underneath, then it's just fashion on top. But don't walk around with a crochet mask thinking that you're about to protect something, because that's literally not happening. What were you about to say, Dr. Muhammad?
I was just going to say that's a real thing.
Yeah, no, literally, yes. It's a real thing. It's a real thing. I wanted to make sure that we double backed to you, Dr. Kamilah, because you do work in the hospital. You are an X-ray tech, correct?
Correct.
Tell us some of the things that you actually see when you're doing X-rays, when you're looking at X-rays, with the patients, because I'm hoping that your actual experience in the hospital, seeing patients and seeing X-rays of people's lungs, can help people to get a better grasp of what's actually happening with this disease process?
So first and foremost, I will say this. Just like I tell patients in the hospital, I don't get paid the big bucks, so I don't read the x-rays. So pretty much what you basically will be seeing on a chest x-ray is you may see, we call it more radio opaque. With radio opaque, basically you'll see more whiteness. I was not thinking, so forgive me. I should have pulled up like a chest x-ray. But basically, if you see an x-ray, here is a good one. So this is a chest x-ray. So where you see white, that is radio opaque. So that means it's dark. If a person has like COVID or like an advanced stage of COVID, you may see like more whiteness where there's black. The black area is what we call radiolucent. The black area is air, basically. So this is what your chest x-ray should look like. This is a normal chest x-ray. So if you have that, like I said, any extra white looking, any extra white spots in the lung area, then that's an issue. We don't want that. I hope that answers your question.
It did. It did. So again, I just wanted to make sure that people understand what actually is happening. And then we also have like this whole inflammatory condition that's systemic and body-wide that seems to be happening to children. There seems to also be some coagulation, so a lot of blood clots popping off and jumping around the body. That is now that I'm hearing about now. So it's a lot of all of it, a lot of different symptoms. So it's not just a lung thing, right? It's not just a lung thing. Let's sort of wrap up and talk about what you naturopathically would recommend to your family and friends to do to actually, again, fortify their health, to help to decrease their chances of getting coronavirus or any other condition. Because the reality is there is no cure, right? There is no cure that we know of. It either runs its course, it, takes you out, or it, you get it and you have to deal with the consequences. So how do you tell people to prepare themselves, their bodies, for this second wave that should probably be coming?
I guess I can start. One of the things I have been telling my family, friends, is making sure you are doing things to support your immune system. One of the biggest keys is making sure your immune system is as active as it can to help fight off infection, fight off the virus, things of that sort. Eating a good diet, exercising, managing your stress, doing things that you enjoy, just being proactive in that sense, making sure you're getting enough rest, things of that sort that you would generally do even if it wasn't a virus, even though, the virus, but still think of it as these are the things I should be doing regardless. So doing things such as that, I feel, will help to lower your chances and also improve your overall health just in general.
Intern Kamilah or Dr. Kamilah?
So pretty much like what Dr. Burnett said, lowering your stress. Number one, like I said, get your vitamins and minerals from your food. So if you can, do better with your diet. If you can't, of course, there's supplements. I'm huge on elderberry. That's what I take. I love elderberry. I do fish oil. I also do probiotics as well. Also, too, exercise is good. The lymphatic system is there to help us get rid of toxins out of our body, but the lymphatic system doesn't use the heart to pump. Well, what gets the lymphatic system to start pumping and circulating is our muscles contracting. Well, one way to get your muscles contracting is if you exercise. So if you start exercising, that will also help the lymphatic system do what it's made to do. When you start exercising and you sweat, you can get some of that toxins out. If you happen to get ill, you can do what we call the wet sock treatment. Also, if you happen to get ill, you can kick up that elderberry. Like I said, I'm pro elderberry. There's also echinacea that people love. There's garlic. There's so many different things that you can do to that works for you and works for your lifestyle. Overall, it's doing things that we should already be doing. Hand hygiene, getting rest, lowering stress, things of that nature.
So again, there is no cure at the moment for coronavirus that we know of. The things that we're telling you are some of the things that we actually do to support and strengthen our own immune system. And at this point, this is like the best defense that we know of. Dr. Braxton.
So along with all the other things that they mentioned, vitamin C is...
Speak up a little bit.
Sorry. Along with all of the other things that they have mentioned, vitamin C is very helpful and beneficial at this point, because at least for post-COVID, a lot of people are seeing hemorrhaging or clotting, things like that. So vitamin C is protective for your blood vessels. And so what you want to do is they recommend you take vitamin C to bowel tolerance. That just means take so much that you can handle until you start having diarrhea, and then you cut back a little bit. Vitamin C, vitamin D is it's helpful for your immune system. Zinc, a lot of people are very deficient in zinc. That is very helpful. She already mentioned fish oils, of course. I know a lot of people are on the sea moss wave, but basically, just like they said, whole foods. Try to eat things that actually come from the earth and not from a box. So if you're trying to be proactive and prevent, things from transpiring in a negative way, treat your body as nature would. Give it what it is asking for. So your body loves to move. The only reason why you eat is to energize your cells. So don't be overeating either. So you eat to energize your cells, you move to keep that energy flowing properly, and then also taking care of your mental health. So if you find yourself being consumed by all the social media and all of the things that, the government is putting out and all these things, if you're consumed by that, it may be time for you to fast from social media. Maybe time for you to fast from just being engaged with society and go ahead and get some mental health therapy. I'm always going to be an advocate for that. I know a lot of people are not aware, but there are telemedicine for mental health. So if you find yourself being in a depressive mood for way too long, go ahead and go and see if they have any telemedicine that you can take advantage of. Most insurance companies will have referrals or people that they recommend. So if you have insurance, make sure that you are looking into telemedicine in terms of mental health therapies. Also, yeah, like she said, have fun, get out and engage with people, your family as best you can, social physical distancing and things like that. But be sure to just look at your body as a whole and not a piece. So all of these things have to happen in concert with each other to support you holistically so that you can build your immune system. This doesn't mean that you won't get infected, but it just means that if something does come to attack your body, the defense is strong enough to fight it where you can win the battle and it won't win. So yeah, that's some of my recommendations.
Thank you. Dr. Muhammad.
I say everything that everybody else already said. Avoiding crap like high fructose corn syrup, which is the devil, avoiding stuff like that, avoiding excessive sugar, avoiding excessive dairy products. Like the stress piece is huge, especially with all that's going on right now, like relative to Black people in America. Like that's just stressful in and of itself, like outside of coronavirus. Also, same thing like vitamin C. I typically tell people when they do vitamin C is to dose it like every hour, like smaller doses. The smaller the dose, the more you absorb. And so if you take around like, I think it's like 100 milligrams, you will absorb 100% of that, versus if you take like a high gram dose, you'll absorb maybe half of that, but you still get a lot in. So the bowel tolerance, yes, I agree with that. Also, I'll have people just do those little orange cuties, like have one or those oranges every hour or so. Vitamin A is a good one. I never recommend supplementing with vitamin A because it can contribute to liver damage and brain swelling. So I'll just say eat like carotenoid-rich foods, which go to produce vitamin A, which is useful for natural killer cell activity. The B vitamins, like a lot of plant-based things, there are specific botanicals that I will recommend, but I just don't want to like give them out for people to just go start buying them in bulk. So because every case is different. Now, a lot of people have like autoimmune diseases and you don't want to overstimulate them. But yeah, everything else that everybody else said, yeah.
Thank you. And I would actually say, first of all, don't go out and just purchase a laundry list of everything that we mentioned. Please don't go do that. The moral of the story is that there are things out here that you can do to make your body stronger, to make your immune system stronger, and you want to do it as naturally as possible. And just to sum up some of the things would be to make sure that you reduce your stress level, whether that is turning off social media, taking deep breaths, going for walks, doing things that you enjoy. Stress is one of the number one things that is going to put you at higher risk for getting diseases in general. Get some sleep, whatever that looks like for you, get some sleep. If you're having trouble sleeping, come see one of us, make an appointment to see one of us or see another naturopathic doctor, because sleep is vital. If you're not getting very much sleep, then you are putting yourself at risk for increased obesity and metabolic syndrome and hypertension, inflammation, and all the things that are putting you at risk for coronavirus. Eat a well-balanced meal as much as you can. If you have to hide the vegetables in other food, please do it. Just get them in. You can get a crappy blender and blend some stuff up and put it in your sauces and your gravies, and it'll be fine. But do that and use your supplements as a supplement, as a last resort, as something to help along with the other things you're doing. And then enjoy your life. Find ways to smile. Find ways to be happy. When you're smiling, when you're happy, you cannot be as depressed as long, right? You're taking a break in that. You're taking a break in anger. You're taking a break in stress. So find something every day that you enjoy so that you're not always in that fight or flight mode that's going to put you in chronic stress. Thank you, ladies, for joining me. How can people follow you or contact you on social media or your websites? Let's start with Dr. Muhammad.
So my website is just my name. It's www.asiamuhammad.com. And then my social media, Instagram, is just dr.asiamuhammad. And then same thing with Facebook. And I typically respond to people if you do free on the free 10-minute phone consult, you get a response.
So. Intern Braxton, do you have a way that people can contact you on website or social media?
Okay, so social media, my name, Aquila Braxton, whether you're looking for me on Instagram or Facebook, or if it's something professional that you want to discuss, you can email me at aquilabraxton@gmail.com. And I also wanted to mention, we did not say nothing about water, but y'all, we need to make sure we stay very well hydrated. Water helps with so many biochemical activities going on in our body. So I'm sorry we didn't mention that, but that's something that I wanted to add.
Okay. Thank you for that. Go ahead.
Okay, so you can reach me on Facebook at Princess Burnett, and also we are also in clinic, so we also doing telehealth visits, as well as we will be back in clinic starting next week. So our School can be contacted for the clinic to set up appointments, as well as additional to telehealth. Our hours are Mondays 1 through 7, Tuesdays 11 to 5, Wednesdays my hours are 7 to 1, and Dr. Braxton's hours are 1 to 7, and Thursdays 11 to 5, and Fridays from 7 to 1 as well.
What was that contact information for the school again? Did you give that?
I could post, I don't have the number on top of my head. But
in UHS Whole Health Clinic, you can find them on Google. Okay. It's really easy. Just type in NUHS Whole Health Clinic.
All right, so these interns can be seen at National University of Health Sciences. You can just take down their names and contact the clinic and see when they have availabilities. Dr. Kamilah, how are you contacted?
So on Facebook, it's just my name, Kamilah Hamilton. And on Instagram, I am under complete.1, and 1 is spelled out.
All right, Instagram, that's complete.1?
Yes.
And 1 is spelled out?
Yes.
All right. And I can be found, my website is www.drturshá.com. That's DRTURSHA.com. And on Instagram, Facebook, Twitter, YouTube, I'm at Dr. Turshá, DRTURSHA. Thank you all for joining us. I appreciate you for adding to the conversation and joining us as we discuss these things. If you have topics that you'd like to know more about, please inbox the Indies of Color, send us a message, and we will do our best to add that to the rotation of topics. And we look forward to seeing you next week. Thank you, and take care of yourselves, take care of your families, and we will see you soon. Bye.
Bye.